I'm Dr. Savio Mathew. I'm a consultant physician working with Ranai Medicity Hospital, Kochi. I've been a physician for the past 8 years, and in our daily practice, hypertension is one disease that we have to deal with on a daily basis. Most of the patients who come to us with hypertension are mostly over the age of 40, but that used to be the norm a couple of years back. But of lately, we've been seeing patients who are diagnosed with hypertension at a much younger age. For example, let's say patients who are slightly over the age of 20. So hypertension is becoming a burning problem of the era. So generally, everyone would like to have a healthy or normal blood pressure. But what exactly does it mean? So what exactly do you mean by the term blood pressure? So blood pressure is something when your heart pumps the blood and that blood gets pumped into your arteries. And that pressure which the heart exerts onto your arteries, onto your blood vessels, that is what we record as your blood pressure. So it is very commonly done in our OP practices. We use a sphygmomanometer, that is the machine that the BP apparatus that we use. And it has got a dual mode of BP recording. That is, we have a systolic blood pressure and a diastolic blood pressure. So when the heart pumps the blood against your blood vessels, that is a systolic reading. And when there is a peripheral resistance against which the blood flows, that is your diastolic reading. So the normal value as per the JNC, that is Joint National Council, the guideline, as per the guidelines, 140 by 90 is taken as a cutoff. Most of the people have this notion that your normal blood pressure is 120 by 80. But actually hypertension, or actually your blood pressure is usually said to be a range which is between 90 by 60. That is, the lowest reading would be a 90 by 60 and your highest reading would be a 140 by 90. So any blood pressure recording which is in the range of 90 by 60 to 140 by 90 is said to be a normal hypertension. It is said to be a normal blood pressure. And hypertension is diagnosed when your blood pressure readings are more than 140 by 90 in 3 consecutive readings, not just one reading, but in 3 consecutive readings when the BP is recorded, when all the values fall above 140 by 90, you are coined as a hypertensive. And when your BP is less than 90 by 60, even in a single reading, then it is said that you have hypotension or low blood pressure. So this is the essence of recording blood pressure in the OP setup or in an IP setup, or when you see a patient for whom you record your blood pressure. Now, what are the factors? Now, high blood pressure, what are the factors which contribute towards a patient developing hypertension? Like we all know, hypertension is a multifactorial disease. It does not have a single cause. Like, for example, when you say that you have a viral fever, you would have contracted it through a person who has already gotten viral fever. So it's a person-to-person contact, and that is one single factor. As in, your exposure to a person with viral fever gives you a viral fever. So that is like a single factorial contribution. Whereas in hypertension, it is a polygenic. That is, there are multiple factors which contribute towards hypertension. The first being age. As people get older, their arteries stiffen up, and that can contribute to a high blood pressure. Your family history of hypertension, definitely your risk of developing hypertension is several times higher than a normal person. Excess salt intake, eating, when people do not eat right, as in when they eat a lot of junk food, a lot of fatty food, a lot of salt in the food, all that contribute towards hypertension. And eating processed food, that's again what I said. And another one is people who have a lot of stress. It may not be just physical stress, it could be emotional stress where people don't sleep well. In all of those settings, you can have a hypertension. Now, the other reason, these are all the factors which contribute towards essential hypertension, and that is what we see in the normal population. That is 90% of the hypertension that is recorded in an essential hypertension or a primary hypertension. Now, there is something called a secondary hypertension. Secondary hypertension is when a person has high BP recording, which is due to multiple factors that are not already mentioned. That is, when they have an underlying kidney disease, or when they have an adrenal disease like a pheochromocytoma, or when they have a thyroid disease where the hyperthyroidism can result in accelerated hypertension. So these are all other factors, other systemic illnesses. Most commonly, renal diseases contribute towards secondary hypertension. So those are the other factors which contribute towards hypertension. Now, early and accurate diagnosis of hypertension is the essence here. The reason why we say that early diagnosis is mandatory is because the longer a patient goes undiagnosed, the greater is the risk of end organ damage. And when you say end organ damage, the end organs that are primarily affected are one is the brain, that is, patients are at a higher risk of developing stroke. The other would be a cardiovascular disease. Patients are at greater risk of developing myocardial infarction, that is a heart attack, or aortic dissection. And the third one would be a kidneys, where patients develop glomerulosclerosis, and that will eventually lead to a chronic kidney disease or end stage renal disease. And patients usually land in dialysis. Now, if your blood pressure level is more than, like I already said, 140/90, not just in a single setting, but in more than 3 settings that is recorded on consecutive days, then you say that the patient has hypertension. And there's another term called accelerated hypertension, wherein a single reading of blood pressure, which is more than 180/100, or when the patient develops or presents with an end organ damage, which is directly involved with hypertension. These are all settings where you need not have multiple readings, but even a single reading of that value is sufficient enough to say that the patient has hypertension. Now, how can you prevent, or what are the positive lifestyle modifications that you can make to help a patient from developing hypertension? The first one would be a regular exercise, healthy diet. Healthy diet would be mostly in the form of salt restriction, quit smoking and alcohol intake, regular blood pressure monitoring. So patients who are already diagnosed with hypertension, it is mandatory that they follow with their physician at regular intervals and keep their blood pressure under check. And adherence to medication. So a lot of patients that we see who are started on antihypertensives, a good number of them do not get back to you on time for a follow-up. So such patients, in spite of taking medications, their BP might not be within the target range, and such patients continue to be exposed to the risk of hypertension. Now, when you say regular exercise and physical activity, that is something which can increase your basal metabolic rate. So when your basal metabolic rate is high, the risk of developing hypertension is much lower. And regular exercise also helps you to maintain a healthy weight. So overweight or obesity or metabolic syndrome altogether is one of the reasons why patients develop hypertension. And the other would be a healthy diet, that is basically salt restricted diet, reduced intake of processed food, reduced intake of smoked food, reduced intake of fatty food. These will all help you to keep your blood pressure well within target. Now, again, smoking cessation. Smoking cessation and alcohol control are two other factors which help, because alcohol is directly a stimulant. It causes a raised blood pressure. Even the nicotine that is present in tobacco, that also contributes towards an elevated blood pressure. Now, when you say that regular BP monitoring, that would the discretion of what a regular the term regular means may not be the same for every single patient. For a patient for whom you identify hypertension and you ask them to come back in 10 days or 2 weeks time, and if you see that the successive readings are all within your target, then maybe you can increase your follow-up dates by a month, 2 months, or 3 months, depending on how well controlled their blood pressures are on subsequent follow-ups. And adherence to medications. So adherence to medication is something that most of the patients fail to understand. See, a single antihypertensive, most of the patients whom we see in the OP, they are usually started on a single antihypertensive, which is appropriate for their age and their associated comorbid conditions. Because for all patients, not all antihypertensives are equally effective, or all antihypertensives are, because for example, a patient who's got an underlying kidney disease, we try to avoid angiotensin receptor blockers. ARBs are avoided for such patients, even ACE inhibitors, because that again increases the renal stress. And for patients in whom there is pedal edema, we try to avoid CCBs, mostly amlodipine. And for patients who are older and who have an underlying cardiovascular disease, in such patients, a beta blocker would be a better choice. And in patients who are old and in patients who are at higher risk of hyponatremia, as far as possible, we try to give diuretics. So these are all the judgments that a physician takes depending on the age of the patient, the clinical setting, the associated comorbidities. So these are all taken into consideration before prescribing an antihypertensive. And we start the patient on the lowest dose, which probably might be appropriate, and then titrate the dose based on the subsequent BP recordings. So it is mandatory that a patient follows up regularly so that the appropriate medicine, the appropriate dose, and the side effect profile can be frequently monitored, and the BP can be kept under check, and the patient can be helped from developing end organ damage that is mostly in the form of a chronic kidney disease, that is an end-stage renal disease, or a cardiovascular disease, or a cerebrovascular accident that is mostly in the form of a stroke. So these are the targets that are kept in place so that patients do not land up in catastrophe, which is directly associated with hypertension being a single risk factor in most of the diseases that I already mentioned. So let us be diligent in choosing the antihypertensive. Let the patients be more aware that they have to come regularly for a follow-up so that the hypertension is kept under control and your BP recordings are well within target. And so that the side effect profile is most of these medicines, because the medicines may not have the same effect on on different patients. For example, not all patients who are put on amlodipine develop pedal edema. Similarly, not all patients who are given acylnidipine have hyperkalemia. So these are all things that need to be regularly monitored. These are all things that need to be kept in mind when we start an antihypertensive. And patients are urged to make a positive lifestyle modification so that the risk factors which can contribute towards developing hypertension can be avoided most effectively. Thank you.